Now this is a patient, age 22 years. She has presented with no clinical, detailed clinical history, gynecological examination, no lab profile, no nothing. And the history is that she is having anuria for the last 2 weeks with vomiting, and she is unable to digest anything. And she was catheterized. But on ultrasound, what we see is she is a married female with 2 kids, normal, no cesarean section, no surgical procedures performed, and here we see the right kidney is dilated massively. Now this is the left kidney longitudinal section, measuring 133, whereas the normal should not exceed more than 11 centimeters. This patient measures 13, so the kidney is enlarged in length. Kidney is enlarged in anterior-posterior diameter, measures 5.4 centimeters. There are no calculi seen. Both poles are clear of any focal lesion, and only a bag of fluid is seen with dipping sign. Now this small thread-like structure with the wall of the right kidney are called the dipping sign of massive hydronephrosis. Rest, no debris is seen within this kidney. So far as the proximal ureter is concerned, let's see what is the status. Passa सीधे बेटा सीधी हो जा. Now, don't be misguided by the vessels. This is the IBC, this is the other. Now, don't be misguided by this tubular structure as being a proximal ureter, because you can note the curve of the vessel anteriorly, and you can see the pulsations of the vessels as well. We differentiate it. I do not see any dilation of the proximal ureter in this patient. Now this is the proximal ureter, and you see the proximal ureter is not dilated, measures for 3.6 millimeters, normal is up to 7. So in this case we cannot rule out the possibility of pelvic-ureter junction obstruction. Now this is the left kidney of this young girl. Now in the left kidney we do see the preservation of the parenchyma. Parenchymal thickness is preserved. This is the upper pole. Parenchyma measures 20 millimeters, fine enough. Here it measures 12 millimeters, fine enough. And at the low pole, the parenchyma measures approximately 18.8 millimeters, fine enough. So the parenchyma is intact. Now this is called moderate to massive hydronephrosis, or moderate hydronephrosis, as you can see the cauliflower shape dilation of these calyces. All the calyces are dilated. The parenchymal echogenicity is slightly raised, and the corticomedullary differentiation is muffled, is not that clearly visualized. So she is having parenchymal changes as well. Here you can see that the ureter is dilated. This is the proximal ureter measuring 14.5. Normal should not exceed more than 7 millimeter. So this is a dilated proximal ureter. That side that can be traced up to this level only. No calculus is seen, no calculus is visualized in this studio. So the level of obstruction cannot be reached. In this case, this is the urinary bladder with catheter bulb. This is the urinary bladder. This is the catheter bulb within it. And the urinary bladder itself does not show any thickness of the wall or any calculus. This is the transverse section. This is the longitudinal section. The uterus in longitudinal section is normal. The adnex adnexas are normal with no evidence of any cystic or solid mass in the right or left side. So this is also a case of obstructive uropathy, bilateral obstructive uropathy. Thank you.